and welcome to another installment of Bergeron Briefs. My name is Art Bergeron. I'm an elder law attorney at Myrick O'Connell. The purpose of these shows is to help you as seniors and people who are working with seniors understand the people and programs that you might be able to take advantage of, that might be able to help your life and that of those you love. These programs are really meant to supplement the seminars that I do that talk more in detail to seniors about qualification and all those things. So there are a set of people that you need to know as a senior or as a person who has a loved one who is a senior. One of the most important ones in this area is my friend Christine Alessandro, who is joining us today. Christine is the executive director of an organization called BayPath Elder Services, which is what? What is BayPath Elder Services?
BayPath Elder Services is an Aging Services Access Point, or ASAP, an area agency on aging.
That's a lot.
That is a lot. Yes, it is.
By the way,
that's why we abbreviate it.
By the way, those two terms, ASAP, that's kind of the state term, and Area Agency on Aging, that's like a federal term, right?
You're right there.
But for our purposes, we're just going to talk about your ASAP, you as the ASAP.
Right.
Okay, good.
Me as the ASAP. Good. And we have many programs and services for older adults, for caregivers, and younger persons with disabilities.
I see. So you're specifically focused on the older population. By the way, is there an official definition of that for your purposes? I mean, I feel pretty old. I'm getting older. Well, actually, I just turned 65, so I'm definitely in tune with my clients right now, trying to figure out Medicare, which is always a challenge, right? But is there an official age?
Well, it depends on if you look at the state or federal definition. And for federal purposes, the age is 60 for an older adult. For Medicaid purposes, it's 65. That's where the change in Medicaid takes place.
65 or older.
Right. So we look at folks who are 60 and above for the state home care program, and most of our other programs as well.
I see. And you're a nonprofit?
That's correct.
So you're not out there selling to folks, right? Because certainly seniors, at least the ones that I know, are besieged by folks who are trying to sell services. You are actually providing. So where does your money come from?
We are primarily funded by the state, but we also get some federal funding, and we apply for grants. We get private donations.
I see.
But the bulk of our funding is state funding, which is your tax dollars at work.
Our tax dollars at work.
Right.
Yes. And by the way, how did you end up at BayPath? So was this how did this become a career choice?
Well, actually, I was living in New York City for many years. I was working in long-term care, very large nursing homes in New York City. And I moved up here in 1998 and decided at that time that I'd like to work with older adults living in the community.
As opposed to in a big institutional setting.
Exactly.
Yeah.
So I got the job at BayPath. Been there ever since.
Oh, that's great. You're a long-term
16 going on 17 years, yes.
Oh, that's a lot.
It is.
And BayPath covers what area? I know it covers Northborough.
Yes.
And how big is the total area that is covered by BayPath?
We have 14 communities in Metro West. Yeah. So I usually start at Sudbury, Wayland, Hudson, Marlborough, Northborough, Southborough, Westborough, Natick, Framingham, Ashland, Holliston, Hopkinton, Sherborne, Dover.
Congratulations, you did it again. So Northborough and Westborough and Hudson are kind of like the western border of this, your territory, but your offices are where?
We are in Marlborough.
You're in Marlborough.
Right off 495.
And how many staff do you have?
Right now, about 116.
A lot of staff.
A lot of staff, but many of them are in the field. For example, in the elder nutrition program. So many of the senior centers are nutrition sites as well. So you have staff working out of there. Not everyone's in our office.
Is in your office. And you're working closely in turn with all of the various senior centers and councils on aging.
Yes,
right?
Through nutrition programs, healthy living programs, grant-funded programs that we might do.
So let's talk a little bit about the programs, because for folks who are watching, they may be saying, so what does this have to do with me exactly, right? And by the way, one of the things that I would urge people to do once they've heard you talk and had this conversation is that if they have questions, to give you folks a call, right? So if I am a younger person, I'm 65.
You're a younger person.
Yes, my wife and I, she's going to be 64. I almost slipped. And so why would I be interested in anything that you folks have to offer?
Well, there is a perception out there that we only work with people who are lower income, very old, very frail, very
really frail.
needy.
Right.
And that is not true. The truth is very far from that.
Yeah.
We offer programs for younger, older people, such as yourself, for healthy living. If you have chronic disease and you want to learn to live with your chronic disease, we have a program for that. We have a program for nutrition and healthy eating. So we have volunteer opportunities as well.
And when you talk about the healthy living and healthy eating programs, are these like seminars that you do, or are these consultations that you do with individuals? What are those programs about?
They're actually groups that get together for, say, a 6-week period.
Oh.
And there's a whole curriculum. So it's a class.
I see. Really around, and certainly that's something that, for me, for folks who are my age, and you're trying to look at, your goal in life is not just to live long, but to live well. So those are like really important questions.
Exactly,
right?
exactly. And the nice thing about the nutrition program that we do, you get to go out to dinner at the end.
Oh, that's great. That's great. Now, are those programs offered for free, or am I paying a fee in order to get involved?
Some are free. There is a fee for, just like all of the programs at BayPath.
Yeah.
Some are free.
Yeah.
Some are on a sliding fee scale, and others are income based. So it's always best to call and check.
Best to call and check. Now, something else that you do that affects a lot of seniors, you are the famous purveyors of Meals on Wheels.
We are the Meals on Wheels people.
Which was one of your original basic programs of the ASAPs, if I recall correctly.
That's correct, and Meals on Wheels was established under the Older Americans Act.
Which is like 1960s.
Yes.
I was just a kid. Right? And so Meals on Wheels, and so how does Meals on Wheels work? First of all, is everybody eligible for Meals on Wheels?
There is no income eligibility for Meals on Wheels. You do have to be homebound, and if you don't know whether you quite qualify, you can call in and we will come and visit you to establish eligibility. And if you are able to get out of the house, we might ask you if you'd prefer to go to a congregate meal setting.
I see. And a congregate meal setting is like where? Like if I were living here in Northborough, what would be the closest congregate meal setting?
Bolton Street in Marlborough would be the closest meal site for you.
I see.
And for Meals on Wheels, it doesn't cost you. We only request a voluntary donation to help defray cost of the meals, because the funding from the federal government does not cover the entire cost of the meal.
I see.
But we at BayPath will also tell you that we actually sample the meals, because March is National Nutrition Month.
Yeah.
And during this month, each of the staff will take a turn testing the meals.
Oh, that's great.
Including me.
That's great. And now, where do the meals get produced? Is there kind of a central place here within your area?
Well, contrary to popular opinion, I do not stay up all night cooking.
You don't make all
I don't, no. We have
so whenever I get a complaint, it was somebody else's cooking that
yes.
cooked it that day. All right.
We have a contract with a caterer, and they're out of Lancaster. So they're up there at 4 o'clock in the morning cooking the meals, 5 o'clock whenever it is.
Yep.
They truck them down in big trays.
Yep.
And when they get to the meal site, which is usually a senior center, at that point the nutrition staff will take over and take these large meals and then portion them out for individual meals, pack them up, and the volunteers then take them out on the road.
I see. And each of the kind of councils on aging has their own volunteer network to try to make sure the deliveries all get made and stuff.
For the most part, it's through we have a volunteer network for the nutrition program, but we do work in tandem with the councils on aging with their volunteer programs as well.
I see. BayPath actually has one.
Yes. We have about 400 nutrition drivers, volunteer drivers.
That's a lot. And about how many meals?
500 meals a day, Monday through Friday.
That's pretty terrific. That's a whole lot.
That is a lot of food.
So there's Meals on Wheels. There are nutrition programs. There are healthy eating programs. There are healthy aging programs.
Right.
So what else? If I'm I want to say a younger person. If I'm just retiring, what if I'm having some problems at home? I mean, obviously I'm okay living at home, but I need assistance with fixing my food, or maybe getting out, or maybe can you just talk about what other kinds of programs I might be interested in talking to you about?
Absolutely. One of our largest programs is the state home care program, which can provide in-home services to individuals who are age, need, and income eligible. Under this program, you can get assistance with meal preparation, grocery shopping, sometimes homemaking, sometimes personal care. And you have to be over the age of 60, or if under the age of 60, have a diagnosis of Alzheimer's disease. For a single person, your income must be under approximately $27,000 a year.
Yep.
And you have to have 6 what are called functional impairments.
And so you give us an example. What's a functional impairment?
You cannot make your own meals. You cannot do your grocery shopping. You cannot manage your finances. You cannot. You have very limited mobility outside the house.
So I've heard a term that you've used. When you start talking about these impairments, I always use this term, activities of daily living, or the ADLs.
Right.
Which are, and so you test me if I've got them, they are dressing, eating, bathing, toileting, and transferring. And people go, what the heck is transferring? So getting up out of the chair, walking across the room, sitting down, all without the physical assistance of another person, right? You might be able to do it with a walker, but if you need assistance with somebody else, somebody else, you need assistance with that ADL.
Right.
But none of the things you just talked about are those. They aren't the activities of daily living. Is there a name for the things that you're talking about?
Yes, there is. It's called the instrumental activities of daily living.
The instrumental activities of daily living.
I like to think of them as the step behind the activities of daily living, but still those things that are critically needed to help you stay at home. If I can't prepare my meals at home, I'm not going to be able to stay there, because how am I going to eat?
Right.
So you could get Meals on Wheels, or you could get a homemaker in to help you with meal preparation.
By the way, just to step back, I have one more trivia question.
Of course.
Where does being able to take your pills fit into all of those? Is that an activity of daily living? Is that an instrumental activity of daily living? Is it none of the above? Because a lot of times that's a real issue, right? For folks who are at home, they have this vast array of pills that they have to take. Figuring it out.
Right. And it all depends on how much assistance you need and what type of assistance. For instance, if you have difficulty opening the pill bottle, that's one thing. If you need a reminder of when to take it, that's certainly another. So it's more of a, where do you fall along the spectrum with that?
I see.
For some people, the answer to getting a pill bottle open is to get your pills in a blister pack, where you can just pop them through. Pharmacies will do that now. Pharmacies deliver medication, so they're willing to help you with that.
So I didn't mean to get off track. That's just a very common question.
It is.
So if I need help with any of these instrumental activities of daily living, you said there's a program that I may be eligible for?
Yes.
Which is this?
State Home Care Program.
The State Home Care Program. And if I need help, is there some limit to the amount of hours of help that I can get through this program?
Generally, it's approximately 3 hours of homemaking a week.
Which can be used in any of this whole variety of different kinds of services?
Well, generally it's 3 hours of homemaking, or you might get 2 hours of homemaking and Meals on Wheels. So there's a way to work with you to determine what your needs are, the priority of your needs, and what services you would like to help you stay at home.
And how would I go about figuring that out? Do I need to stop by your office in Marlboro? Can I figure it out without, do I have to figure it out on my own? I guess that's my question.
You don't. We will have a case manager come and visit you in your home and do an assessment and help you figure out what your needs are.
I see. So if I call you at some prominent number, right, which we're going to talk about at the end, if I call you, you're going to take some information, or one of your people will take some information, but then a caseworker will actually come and visit my house?
Yes. What we do when you call, you go to our intake and referral department, where they will talk with you to help ascertain and determine what is it that you really want to know. What information can we give you? Is it resources that you need?
Yeah.
Or do we need to do an intake and give a referral to home care? Or do we need to make a referral for you to options counseling or some of the other programs that we have? So it would just go through our central desk and then go out to the proper department.
So you're going to figure all of those things out.
We will help you and work with you to figure that out.
And if I need any of these things, if I need some amount of home care or assistance with any of these instrumental activities of daily living, do you provide that, or do you hire somebody to do that?
We do not provide that.
That's not what none of your staff is doing.
We are not a direct provider of service.
So you're managing things.
We contract with vendor agencies that are out in the community, and we work with them. They will send the homemaker in, so it is a vast network of homemaking and personal care agencies and certified agencies that are helping to provide care in the home.
I see.
So they're working with our nurses and our care managers to put in place the plan of care.
So if I call you and your caseworker comes out and says, you know, you may need some things, but you have too much income, what then? Do you help me to try to figure out where I can find these services anyway? What do you do? Well,
we can have an options counselor come in and visit you to determine what your other options might be. If we determine you're very much over income without a caregiver, we can provide you with a list of private pay services.
Oh.
If you do have a caregiver and you are over income and that caregiver needs respite, you can go into our respite over income program, which provides for services, but you have a higher copay because it goes up to 100% of your income.
I see.
So that's why with all the programs and services, always good to call and talk to us about it and never make the assumption, oh, my mother, or I'm not eligible, or my mother's not eligible.
Right.
Call and talk to us.
And from what you're talking about, almost especially if I am a caregiver, right?
Right.
If I'm a recipient of care, then people would automatically say, well, of course I'm going to call because something might be available. But the idea of knowing if I'm a caregiver that there's some help available for me also, that's crucial.
It is.
So do you do much around just also working with caregivers to just help them understand the way in which to help the people that they're helping?
Absolutely. We have a caregiver specialist on staff that will give you a consultation over the phone or will come out to the house to meet with you individually. Caregiver stress is really important to recognize, and it's also important for people to recognize they are caregivers. Billions and billions of hours are spent every year across the nation in unpaid caregiving. So caregivers need to recognize they need to take care of themselves as well.
Yes, I always tell my clients, I say, the worst thing you can do for your spouse is drop dead.
That's true.
If you really, really want to help your spouse stay healthy, right? And I always suggest also that they keep talking to other caregivers, because so often, we find folks, I think we both see this, people, they want to be responsible for their spouse. Maybe they're a little bit embarrassed that their spouse is needing some help, and so they isolate, right, as opposed to reaching out for help.
Exactly. And we can oftentimes hook folks up with either support groups or even a peer-to-peer mentoring. It always helps to hear from someone else who has been through the journey.
Right. Now, a lot of my folks, well, just most of my folks, as I always tell people, most of my clients are worried about Alzheimer's, or they have Alzheimer's, or someone they love has Alzheimer's, or some other disease that is causing dementia, right? And that the dementia is getting progressive. And their great fear, everyone's great fear is, God forbid, don't make me go to a nursing home, right? So if I am having real trouble, right, and I'm feeling like I or my spouse or the one that I love may need nursing home care, what if anything is available to help me stay at home if I really have progressed beyond just needing a few Meals on Wheels and stuff? What is available?
Well, under our state home care program, we have two programs for folks and these programs provide a higher level of service. The first is for individuals who are non-Medicaid but clinically eligible for a nursing home, and that's an Enhanced Community Options Program, or ECOP.
And by the way, can you just describe what that means, clinically eligible for nursing home care? Because I know I'll talk to clients and say, well, of course, your definition of when you're eligible for the nursing home. And the state's definition may be very different, because for you, you're not going there until it's the very end, right? Which may not be the case as far as the state definition. So talk about that.
I believe it's the qualifying criteria is 3 activities of daily living, assistance with 3 activities of daily living.
And we talked about what those are. Yep.
Right, bathing, toileting, eating.
Dressing,
transferring. You know the list better than me.
Backwards and forwards. So you need assistance with a lot of the activities of daily living.
Yes.
Right.
And the other program for folks who are on Medicaid is called the Choices Program. That also provides a very high level of service, and that we define as over 42 hours per week.
That's a lot of service.
But again, these folks are clinically eligible for a nursing home under Mass Health, Medicaid only. And the important thing to remember with that is if you are a couple and one part of the couple needs assistance, there are certain waiver programs where we can break apart the income and perhaps the individual can become eligible for a Mass Health waiver.
So it may be that, especially I see this in cases of a husband and wife where most of the fixed income, the Social Security and the pension is coming to the husband. And the total income may be very high as a result, but the wife's income is very low.
Right.
And often in those situations, the wife can almost immediately qualify for Mass Health for a number of these programs.
Exactly. And that's why waiver programs were put into place and developed, recognizing that there is some unique needs.
Now, if I need a lot of that care, at home, once again, do I just start off by calling you? And you're going to send a caseworker out to kind of figure all of that out?
Absolutely. We come and visit you in your home. Again, do an assessment of your needs and say, okay, under eligibility guidelines, this is what you're eligible for.
Yep.
And Arthur, what do you think that you need? What will help you stay at home and improve your quality of life? So we're not saying, well, you need A, B, and C, and this is what you have to take.
Right.
It's a dialogue with you about what do you think you need.
And if I don't qualify for those things, but I'm going to be paying privately, can you help me figure out kind of who I can trust? Because I know that's probably the greatest concern for folks who are bringing in folks from the outside. I mean, so often I find they'll tend to go for a relative or go for somebody that they know, even if that person really doesn't have the necessary skill set, right? Rather than risking a stranger, because they're afraid.
Right.
So can you help them figure out get through that process?
Well, there are many vendor agencies in the community. Those that we contract with, we fully vet, and they go through a process with the Executive Office of Elder Affairs to be approved as a vendor under our network as well. And our vetting process also includes annual monitoring. So the best thing to do is talk with whatever agency you choose extensively and ask them questions about, do they query check their employees? What is their process for handling complaints? What if I don't like my worker? Anything that you might ask of any worker coming into your home, whether it's to install a new kitchen or give your mother some help.
And if they called you, because as I always tell people, the nice thing about BayPath is they are the biggest buyer of services in the area. So they're going to, if they don't know who this agency is, you've got to wonder about what this agency is about. Right?
Yes.
If they call you, will you tell them what you know about these agencies?
We can tell you which agencies we contract with, certainly, and then be assured that we have that vetting process behind it.
So that you could feel some sense of safety in terms of calling folks like that.
Right.
So you have a huge array of programs. You have a big staff. You cover a big area. What's new? What is new at BayPath Elder Services? Well,
our Caregiving Metro West website, and I am so glad that you asked.
Well, funny that I mentioned it.
I love to talk about Caregiving Metro West. Our Caregiving Metro West website, which is www.caregivingmetrowest.org, actually covers 25 communities in Metro West and has been partially funded by the Metro West Health Foundation.
But it covers Northborough. It
absolutely covers Northborough.
Right.
And what this does, it's a one-stop online shopping experience or source for information, resources, and support. and it's specifically designed for caregivers. So you can plug in information and get information on the resources in your local communities as well.
Right. What I loved about going to the website is you can literally just click on Northborough and ask all of your questions specifically in relation to Northborough, because once again, you're covering 25 communities. That's a lot, right? Even your base 14 communities.
Right.
I don't want to know about the great person who's in Wayland. I mean, I'm never going to get there. But to be able to kind of really focus on like who's around right here, it's just a wonderful resource.
It is. And it's the fact that you can go to one website, because oftentimes in caregiving, you're going to wind up going to multiple sites to try and figure, because I did that with my mother, you know, it takes a lot of time. It's so nice to have one place to go to. There's a blog that's, you know, updated very frequently. There's what we call Caregiver Concierge.
But by the way, talk about the blog a little bit. What's the point of the blog? The
blog is to keep you updated on events and happenings in the Metro West area having to do with caregivers. So it's a great resource. It's news, announcements. So it really keeps folks updated on what's happening in the caregiver arena.
Now, is that interactive at all? Like, let me put it this way: if I'm savvy enough to go on to the blog or to go to your website, and I have a question. I just had this problem with Ma. What do I do? Is there some place where I can have that conversation online, or do I really need to find a caregiver and have the conversation with the caregiver?
You probably want to have that conversation with the caregiver or give us a call. It's not capable of, the website is not capable of having that question and answer, but it gives you details on how you can contact us and arrange, you know, to get the answer to your question.
I get it. And it's a wonderful website.
It is.
So BayPath Elder Services is one of many ASAPs. The whole state is covered by, each ASAP covers a particular region in the state, is that right?
Correct. Each ASAP covers a defined area within the state, and there are 27 ASAPs. So whatever community you are in, an ASAP is covering that area.
So if someone is listening to this, or they're talking to a friend who has listened to this, right? And they're like, well, I don't live around there. They can find, there's another version of you. Well, there's no other version of you, you know. But there's another version of, there are other people like you who are covering all other parts of the state.
Yes, other agencies just like us offering the same programs under the same standards and eligibility guidelines.
Great. There is nothing or no person or entity that you need to know of as an elder that is more important than your ASAP. Nobody that you need to know that is more important than Christine Alessandro at BayPath Elder Services. As Christine has said, the goal of the exercise is not to have you have to figure out exactly which state or federal program you are eligible for. All you have to do is call them, and they'll help you figure out all of this. Christine, thank you so much for coming in. I hope folks found this enjoyable and entertaining. We'll make sure that there is a banner in this program that gives you the website and also a phone number to call for us who are less than super duper tech friendly. Thank you so much for coming in. Thank you for watching, and I look forward to seeing you on the next show.